Well, it's hard to know what to say to children about this Boston Marathon bombing. Joining us now is Dr. Don Elligan from the University of Chicago Medical Center. Good morning, doctor.
Good morning. Thanks for having me.
First question, we were kind of talking about this off air. Shouldn't you talk to your kids about these things that happen because they have access to the internet? They might hear them in school. Don't you want, a mom and a dad to be the first word they hear about things like this?
Absolutely, but depending on the age of the child, you want to have age-appropriate discussions. So if it's a very young child, you really want to try to focus on limiting their exposure and focusing some of the discussion around how they're safe, secure, and anything that will decrease any of their feelings of vulnerability. For an older child, like an adolescent, you still want to focus on how they're safe and secure and decrease any insecurity or vulnerabilities they may have. And you may allow them to see and discuss this a little bit more regularly than a younger child. However, you really want to limit the exposure still, even with people who are older. Because one of the big things that we know about PTSD is that exposure like this, vicarious exposure, can bring up fears of other things that may be happening in the community, such as violence or bullying at school.
And even seeing just walking past the TV a couple of times, you say that the effect of that PTSD could linger for a while?
Absolutely. One of the things that we know about PTSD is that oftentimes the symptoms don't begin to manifest until 30 days after the traumatic event. So if traumatic events have already occurred in their life, seeing something like this could resurrect fears of something that has previously occurred. And we may begin to see some of these symptoms or memories or fears pop up down the road.
Well, of course, kids mature at different rates, but are there any general guidelines? Is it a 12-year-old that can look at this on TV, you can talk to them about it, and anything younger they can? I mean, do you have a general guideline for parents?
I think each parent has to decide that on their own. Obviously, as they get older, they can handle a little bit more, but there's no specific age at which they can view 2 hours of this type of coverage without being affected.
You know, yesterday there was a picture of Mr. Rogers that went viral on the web that had a quote from him from years ago saying, whenever I saw something bad on the news, my mom said, look for the helpers, look for the people that are helping, they're always there. Mm-hmm. It sounds very simplistic in a Mr. Rogers kind of way, but I think people really connected with that because do you want to point that out to your kids? Look for the good in there?
Absolutely. I mean, that's what I mean by try to decrease the insecurity and the fear by focusing on how they're safe, how there are other people who are helping, so that they don't feel overwhelmed by all these strange and violent occurrences that occur.
In the meantime, it doesn't hurt, though, to keep the TV off.
Absolutely.
All right, Dr. Don Elligan, psychologist, thanks so much for being here this morning.
Thanks for having me.